Hi, I'm David. I'm one of the physios at myPhysioSA, and today I'm here with Orthopaedic Surgeon Jan Tomlinson. Welcome, Jan.
Thank you, David.
And we're going to talk about shoulder bursitis. So, Jan, can you explain what actually is shoulder bursitis?
A bursa is a small sac filled with lubricating fluid which sits between moving surfaces.
Yep.
And the bursa we refer to is the subacromial bursa.
Yes.
It sits under the acromion, which is this small bone here. It sits between this and what's called the rotator cuff muscles, the small stabilising muscles in the shoulder. And when you have bursitis, that bursitis becomes inflamed and is therefore swollen and gives pain with movement in your shoulder.
Okay. So what sort of symptoms would you have if you had shoulder bursitis?
People with bursitis present with what's called a painful arc. So they have pain in movement, which is typically from this point to this point, and more reaching on a diagonal rather than in front and out to the side. They have pain when lifting away from the body.
Yep.
They have pain when driving, or anything with their arms in this position.
Yes.
And particularly they have pain at night, whether lying flat or on the side.
So when someone comes to see you, how do you diagnose that they've got shoulder bursitis?
All right, most people when they get to see me have already seen their GP because I'm a specialist, so most people will come with an ultrasound of their shoulder.
Okay.
But before we even look at the ultrasound of the shoulder, because they can be a little bit confusing, we need to talk to the patient, take a history, get the symptoms we'll have already mentioned to you. Then we examine the shoulder, and most people with bursitis have got very good range of movement. Most people can get their arm all the way up, but they have that painful arc as we described. And then there is a special test. One of the most common would be what's called Job's test, where we get you to put your arm out at 90 degrees to the floor, or parallel to the floor, bend your elbow to 90 degrees and then internally rotate. With people with bursitis, that elicits pain.
Yes.
And then the ultrasound is really very good at diagnosing bursitis. As we said, a bursa is a fluid-filled sac, and on the ultrasound it shows us this big inflamed ball, which is much larger than it should be. And on the ultrasound they can see it squeezing as you are lifting your arm up.
And catching, and that gives you pain.
And catching on the undersurface of the bone, which as you say is what causes the pain.
Okay, so what are the main treatments for bursitis?
So the treatments for bursitis can be conservative or operative, and before we talk about operations we need to talk about conservative management because a large number of people will settle down with conservative management. Simple painkillers can be helpful. Modifying the way people sleep, getting sleep a bit more upright is a big help. Anti-inflammatory medication is useful, but only I find in a small percentage of people. Injections of cortisone into the bursa can definitely be helpful, and I usually recommend 2 injections because we're trying to shrink something from this size down to this size. But with the cortisones and the anti-inflammatories and the whatever else you try, it's very important that people see physiotherapists because we need to correct the balance in the shoulder. We need to make these small rotator cuff muscles, which are the muscles which hold the shoulder in the middle of the joint. We need to make them stronger to make them more effective. And also most people with a bad shoulder end up with a very disorganised rhythm of movement in the shoulder. And we need to get that coordinated, and that's scapular stabilising exercises. The exercises to strengthen the muscles around the shoulder are relatively simple and easy to learn, but I find people struggle to grasp how to get the shoulder blade down.
To be moving properly.
And I find that input from people like you is very important. And I would I'd recommend that everybody who has bursitis really needs a good 3 months or so of exercises and conservative management before we consider anything else.
Okay, so if all the conservative management's failed and they've come to see you, what actually happens in surgery?
So in surgery we are trying to make everything fit through the gap, and the conservative measures, as you said, have failed. So if we can't make everything fit through the gap, then we make the gap bigger. And that involves removing the thickened part of the bursa. So we haven't got so much trying to squeeze through that gap, and then shaving off the underneath surface of the acromion, which is this little bone here. So remove the bursa, reduce the bulk of tissue passing through, shave off the small underneath surface, and really just a couple of millimetres, and everything then can pass through without catching.
Yes.
But it's still important to get back to you afterwards to continue with the exercise program to prevent this from happening again.
Okay, and what's the recovery period like typically?
The recovery period I find is unfortunately quite variable.
Yeah.
I would say that at least half the people are really pretty functional by about 2 weeks.
Yep.
About a quarter of people are quicker that, and about a quarter of people are still struggling to perform activities above shoulder height at about 6 weeks.
Yes.
And it takes about 6 months for people to really not notice any symptoms from their shoulder.
Okay.
But it is a very successful surgery.
That's exactly my next question. So there's a good chance it's going to be a good outcome.
There is a very good chance there's a very good outcome.
Okay. Well, thanks for that, Jan. That was really great stuff. So if someone thinks or knows they have shoulder bursitis and they need to see a specialist, how would they find you?
Okay, so I'm a specialist, as you've said. So anybody coming to see a specialist needs a referral from their local practitioner. Yep. And then I am in Adelaide Hills Orthopaedic Surgery.
Yes.
I consult at 3 Stonehenge Avenue, which is right next to the Stirling Hospital. Yep. And the Stirling Hospital is where I do all my private operating.
Yes.
I do also have a public operating list at Mount Barker Hospital, which is a public hospital. So the surgery there is done at no cost to the patient. Okay. We are very lucky at Mount Barker Hospital. I have a very short waiting time, 6 to 9 months, which may not seem that short, but in comparison to others, it is. Yeah. And we also see, we see private patients, we see public patients, we see work cover and motor vehicle accident patients as well.
Great. Thank you very much for your time today.
Thank you, David.